We're back here at 4 as the summer months are often when people are the most active, which means it's common to notice new aches and pains. One of the most common injuries the Denver Health orthopedic team sees right now is rotator cuff and other shoulder injuries. Here to talk about those and what to do about them is Dr. Jessica Churchill, an orthopedic surgeon over at Denver Health. Dr. Churchill, thanks for being here. Appreciate it.
Thank you for having me.
When I think of summer injuries, I think a lot about like hiking, ankles, legs, mountain bike crashes, but you see an awful lot of shoulder injuries. Why is that?
I do. You're more active during the summer, and honestly, most of our injuries aren't coming from things like mountain biking, but we do see those. Usually it's just people outside with their kids, seeing their neighbors, doing things, getting a little active because the weather's warmer.
Yeah, and then you do something bad, and there goes the shoulder. So what kind of injuries are you seeing? And how do I know, is this something that I just need a little rest, a little naproxen, some time to fix it up, versus I need to go see a specialist like you?
Yeah, so we're seeing mostly rotator cuff injuries, which are the small muscles that move your shoulder around. It's most commonly from things like reaching overhead and stuff like that. The stuff that you notice as a main symptom is pain actually on your upper arm while you're sleeping, difficulty getting comfortable as you sleep, you're tossing and turning a lot, and any weakness or difficulty overhead, reaching for your plates in the kitchen, that sort of thing. Okay, and how do you fix that? Is this something that definitely has to go to surgery? Can you do PT, injections? Are there other options too? There are a lot of options for rotator cuff injuries. The main important thing is getting it diagnosed early. So you can do physical therapy and injections. A lot of patients do wonderfully with that. Depends on your age and the injury. And sometimes you do need surgery, and we're happy to provide that. But the main thing is you have to see and get it diagnosed as soon as possible, because the longer you wait, it becomes difficult, if not impossible, to fix them. Do you see other injuries too, just with either overuse for like people who say go to the gym, lift weights, or doing that same motion over and over again, or people who just get older and their shoulders get a little weaker? Yeah, both. So overuse injuries, very common. People who like to press, people who like to lift, or even just picking up a toddler over and over again and things like that, or working in line, Amazon for a warehouse, that sort of repetitive injury, common. But also very common to just have these muscles wear out as we get older. And we're living longer, so everyone's getting older in this area. And you just need a little something to fix it up, right? Little oil change. Okay, that's a good way to put it. Dr. Churchill from Denver Health. It's good to see you. Thanks so much for all that.